Good evening, I'm Prasad Michael and you're watching Kini News, the show that brings you today's biggest stories. With the number of new cases today, Malaysia now has close to 3,000 COVID-19 patients being treated. This is the worst level since the pandemic started in Malaysia in January. Malaysia has reported another record-breaking number of new COVID-19 cases with 691 new infections today. Of the 691 new cases, 688 were local transmissions and 3 were imported cases. Health Ministry Director General Dr. Norhisham Abdullah revealed that 394 of the local cases were from the Tembok cluster in Kedah, which involves the Alustar prison, and the area is already under an administratively enforced targeted enhanced movement control order. Hence, he said, the cluster is isolated from the community at large. Malaysia has also reported 4 new deaths today, including a 1-year-old toddler, Malaysia's youngest COVID-19 victim. This brings the death toll to 141 so far.
Kes kematian ketiga iaitu kes 140 iaitu kes 12,432 merupakan bayi lelaki warga negara Malaysia berumur 1 tahun. Kes dibawa mendapatkan rawatan di Jabatan Kecemasan dan Trauma Hospital Sempurna pada 1 Oktober 2020. Keadaan kesihatan kes didapati merosot dan memerlukan bantuan pernafasan. Saringan COVID-19 didapati positif pada 5 Oktober 2020. Kes disahkan meninggal dunia pada 5 Oktober 2020 jam 4.25 petang.
Addressing the nation from his home today, the Prime Minister announced that MCO 2.0 will not be implemented for now. As the nation continues to record a surge of new COVID-19 cases, Prime Minister Muhyiddin Yassin has ruled out a nationwide lockdown.
Setakat hari ini, kita tidak memikirkan soal melaksanakan perintah kawalan pergerakan di seluruh negara atau total lockdown. Langkah ini jika dilaksanakan sekali lagi, boleh membawa kesan besar yang dikhawatiri akan meruntuhkan sistem sosial dan ekonomi negara. Na'udzubillah. Apa yang akan dilakukan oleh kerajaan ialah melaksanakan perintah kawalan pergerakan diperketatkan secara bersasar di kawasan-kawasan yang dikenal pasti mempunyai kes-kes COVID-19 yang tinggi.
Muhyiddin, who said the government expected new COVID-19 cases to increase in the coming days, said the government would instead adopt a targeted approach. He also urged Malaysians to comply with the SOPs and rules set to curb the spread of COVID-19.
Jika ada yang melanggar undang-undang, hukuman kompaun dan lain-lain akan dikenakan tanpa mengira pangkat dan darjat. Maaflah jika Abah ini mula menggunakan rotan sekarang.
Muhyiddin said over the months the government had gained a better understanding of the behaviour of COVID-19 and was in a better position to manage the outbreak. Meanwhile, the Prime Minister also announced that schools in red zones will be ordered to close. Many of the country's top government officials are currently under quarantine at home. This includes the Health Ministry's leading official. Malaysia's top official leading the fight against COVID-19, Dr. Norhisham Abdullah, has been placed under quarantine at home. The Health Ministry's Corporate Communications Division confirmed to the media that the Health Director General would not be conducting his press conference at the usual location in Putrajaya. Due to the quarantine, Dr. Hisham will be conducting the press conference live from his home without the presence of the media. However, the media could still ask him questions by sending it to him. A Health Ministry representative said Dr. Hisham will answer the appropriate questions during the broadcast. Dr. Hisham's quarantine comes after Religious Affairs Minister Zulkifli Muhammad Al-Bakri became the first Malaysian cabinet member to test positive for COVID-19. Among those who are required to undergo quarantine are Prime Minister Muhyiddin Yassin, Defence Minister Ismail Sabri Yaakob and Inspector General of Police Abdul Hamid Badr. Others who attended a meeting with Zulkifli recently include Dr. Hisham. Prior to testing positive, Zulkifli had attended events across 5 states and territories, including 3 mosques and 3 universities. Sabah will be closing its borders to contain the spread of COVID-19 in the country, starting October 12th to October 25th. Non-Sabahans will no longer be allowed to enter the state to stop the spread of COVID-19. The only people allowed into Sabah now are Malaysians with the H code at the bottom right of their My cards. However, there will be exceptions for those providing essential services, students and civil servants. Meanwhile, anyone currently in Sabah will not be allowed to leave the state unless for emergencies or official duties, and this too only with permission from the Health Ministry. Foreigners with the MyPR card with the H code and those with an entry permit card or endorsement permit on their passports will also be allowed entry. Others wishing to enter Sabah must seek permission from the Sabah's Home Affairs and Research Office. Those requiring further clarification should contact the Sabah Disaster Management Operations Centre at 088 369 434. As of noon yesterday, Sabah reported the most number of active COVID-19 cases at 1,334. 4 districts, Kota Kinabalu, Tawau, Semporna and Lahad currently have triple-digit active cases. Residents in these 4 districts, along with those in Putatan, Penampang and Kunak, are under strict stay-at-home orders, with most businesses ordered to close except for those providing essential services. A ban on inter-district travel has been imposed on the remaining 19 districts in the state. Malaysia's first cabinet minister to catch COVID-19 has once again apologized for his shortcomings.
Religious Affairs Minister Zulkifli Muhammad Al-Bakri, who tested positive for COVID-19, has once again apologized to the public. In a message posted on Facebook, he also said he's taking the time while under quarantine for self-reflection and personal improvement. Yesterday, Zulkifli had issued an apology for his weakness and shortcomings in advising members of the public who attended events he had participated in between September 24th and October 4th to get tested for the disease. Today, Zulkifli also shared his work report card for August. It involved details of an RM352.9 million fund disbursed for assistance in regard to COVID-19 and numerous activities carried out. He said, although his schedule in August was mostly focused on parliament duties, the agencies under his purview were committed to delivering on their respective programs. On October 3rd, Zulkifli had attended a special National Security Council meeting chaired by the Prime Minister Muhyiddin Yassin. All those identified as close contacts at the NSC meeting have been issued with a 14-day home surveillance order together with their quarantine wristbands. Others at the meeting who were not close contacts are required to monitor their health from their homes using the MySejahtera app's home assessment tool.
Coming up next, US President Donald Trump is out of the hospital, but something he did after returning to the White House has left many people angry. It didn't take long for US President Donald Trump to find himself in a new controversy after being discharged from the hospital. US President Donald Trump faced a fresh backlash on Tuesday for removing his mask when he returned to the White House and for urging Americans not to fear COVID-19 that has killed more than 209,000 people in the country and put him in the hospital. Trump arrived at the White House on Monday in a made-for-television spectacle in which he descended from his Marine One helicopter wearing a white surgical mask, only to remove it as he posed, saluting and waving.
As your leader, I had to do that. I knew there's danger to it, but I had to do it. I stood out front. I led. Nobody that's a leader would not do what I did. And I know there's a risk, there's a danger, but that's okay. And now I'm better, and maybe I'm immune, I don't know. But don't let it dominate your lives. Get out there, be careful. We have the best medicines in the world, and it all happened very shortly, and they're all getting approved, and the vaccines are coming momentarily. Thank you very much, and Walter Reed, what a group of people. Thank you very much.
Trump, who was treated by an army of doctors and received experimental treatment, has reportedly downplayed a disease that has killed more than 1 million people worldwide and left his own country with the highest death toll in the world. The Republican president running for re-election against Democrat Joe Biden in the November 3rd election was admitted to the hospital on Friday after being diagnosed with the disease. Trump has reportedly flouted social distancing guidelines meant to curb the virus spread and ignored his own medical advisors. He also mocked Biden at last Tuesday's presidential debate for wearing a mask at events, even when he is far from others. His decision to remove his mask after climbing the staircase to the White House and his insistence that Americans should not fear the disease horrified some physicians. A White House spokesperson said every precaution was being taken to protect the president and his family. Physical access to Trump would be limited and appropriate protective equipment would be worn by those near him. Questions continue to swirl about the true state of Trump's health after a weekend in which his doctors offered contradictory or opaque assessments of his condition. The pandemic has only sparked a rush for plastic, but intensified a price war between recycled and new plastic.
The coronavirus pandemic has sparked a rush for plastic, just as the world seemed to be waking up to its damaging environmental impact. Masks, hospital gowns, and all manner of medical equipment are made from plastic. As demand surged, so did the waste, and most of it can't be recycled. The economic slowdown is only adding to the problem by intensifying the price war between recycled and new plastic. It's a war that recyclers worldwide admit they are losing.
They're running out of runway. And I think that's happening globally. This is a massive disruption to all industries, and recycling is not immune to it.
The punctured global demand for oil has in turn led to a price cut for new plastic. Known to the industry as virgin, it can now be half the price of recycled.
I think the pandemic exacerbated this tsunami. We found ourselves in what would have been maybe a decade ago, the unimaginable position in the United States of being the cheapest place in the world to make virgin plastic.
It's a tough one for plastic recyclers already struggling with lockdown losses.
The combination of the impacts of COVID-19 and low oil prices is kind of a double whammy for the plastic recycling value chain across South and Southeast Asia.
Since the coronavirus struck, recyclers worldwide told Reuters their businesses have shrunk by 20% in Europe, 50% in parts of Asia, and as much as 60% for some firms in the United States.
40 to 60% of the plastic recycling value chain are at risk of permanent closure or bankruptcy right now. And we're talking about the front lines of plastic pollution prevention, waste pickers, aggregators, junk shops, things like that.
Plastic makers are keen to stress that their products have saved lives.
Early on, it was determined that plastic was going to be needed for things like masks and gowns and the plastic sheeting we see or on face masks or used around registers or other locations.
It's good news for the oil industry, which has long hoped new plastic will prop future demand for fossil fuels as the shift to electric vehicles begins to sap its biggest market. Some in the industry even maintain plastic is vital for a shift to a low-carbon future. But plastic is an accepted and significant driver of climate change. The manufacturing of 4 plastic bottles alone releases the equivalent greenhouse gas emissions to drive 1 mile in a car, according to the World Economic Forum. Then, there's the devastating environmental damage plastic pollution can cause. The company said they share concerns about waste and are supporting efforts to reduce it. But many decline to specify how much they are investing in recycling or how far they are reducing waste.
And that is all from me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll be back with more tomorrow, same time, same place. I'm Prasad Michael. Thank you for watching.